Hi everyone, I'm Dr. Jyotpal Singh, and today we're going to be talking about the heart, and specifically, we're going to focus today on understanding the cardiac cycle. And our presentation is called Time is Muscle. And a big idea here is that we're going to talk about the heartbeat and what happens within every single heartbeat, including, how long should certain events be occurring, and really, the whole idea is that we're going to go through something called the cardiac cycle, and that's essentially the process of everything that happens with your heart from one heartbeat to the next. And we're going to walk through the cycle, not just the basics, but we're going to dig in a little bit and also talk about how the cardiac timing can actually reveal our cardiac performance. The first question we have to ask is, what is the heart? And really, your heart functions to pump blood to the rest of the organs and the tissues that require oxygen throughout your body. So essentially, your heart has these specialized cells that make up the muscle of the heart, and that's called your cardiomyocytes. And these cardiomyocytes are what allow your heart to really contract and squeeze and get the blood out there. The heart itself has some upper chambers. So these upper chambers are called your atrium, and it also has two lower chambers, so these are called your ventricles. The atrium is going to receive the blood after your lung has breathed in oxygen in order to give the blood oxygen. It'll go into your left atrium. The blood will then go into your left ventricle, and then after your heart squeezes or your ventricle squeezes, it pushes the blood out into the rest of the body there as well. So really, in order to talk about the heart, we have to identify a foundation or a baseline for our heart, and we're going to call that our heart rate. Okay? So I'm sure everyone has heard about heart rate before, but essentially, your heart rate is the time that it takes for one heartbeat to occur to the next, and so on. It's measured usually in beats per minute, so how many ever beats your heart gets in a minute, that would be essentially your heart rate. When we're sitting there or lying down and resting, our normal heart rate is roughly 60 to 100 beats per minute. And 100 beats per minute would be on quite a bit of a higher end. Anything about 80 and higher would be considered to be on the higher end. But it still would be a relatively normal heart rate as well. So essentially, because a cardiac cycle is from one heartbeat to the next, a single cardiac cycle can be anywhere from 0.6 all the way up to 1 second on average. And your cardiac cycle is going to be split into two different phases. The very first one is called systole, and systole is the phase of contraction, so when the heart is squeezing and pumping that blood out. That's usually about 1/3 of the entire cardiac cycle. And then the other 2/3 of the cardiac cycle is when your heart is relaxed and it's filling up with blood. And essentially, this is directly associated to your heart rate. So, of course, the faster your heart rate, the faster systole and diastole will occur. Okay, so let's zoom into the cardiac cycle here for a quick second. We could see this figure of a heart, and there's quite a bit going on. The heart is expanding, it's squeezing, certain valves are popping open and closed, and there's a lot of different activities going on here that really provide an insight into what happens to your heart with every heartbeat. When we talk about systole, that's the phase where blood is ejected from the ventricles. Now, right before blood is about to push through the heart, there's a short pause that actually occurs. This pause is called the isovolumic contraction, and essentially this is when the ventricles, so the bottom part of the heart, is contracting, so it's squeezing, but all the valves are closed and it's building up pressure. Okay, so that's your isovolumic contraction time, and then as soon as enough pressure is built, that valve pops open and there's a sudden rush of blood that comes out of the heart. And that is called that rapid ejection phase. So this is essentially when the valve opens and the blood is expelled out. After this rapid ejection phase, we get a longer contraction that's sustained, and that's our left ventricular ejection time. So ejection time is essentially the time period after rapid ejection when your heart stays squeezed in order to get out an adequate amount of blood. If we consider diastole, so this is, after the heart squeezes or after systole, our heart starts to relax again. And again, when it relaxes, there's a brief pause. So now this is called isovolumic relaxation. Okay? So this is when all the valves in the heart are shut, and essentially the ventricles begin to decrease their pressure. By doing this, we allow blood to start filling back into the heart, and this is our diastolic filling time. So the time period where the heart is filling up with blood. Once the heart is all filled up with blood, we get a small contraction in the upper chamber, so that's called an atrial contraction. And by doing that, we trigger the next phase of systole, or the next contraction period as well. Essentially, by measuring the cardiac cycle, we're able to identify all these different parts of the cardiac cycle in milliseconds. So how quickly are these things occurring? And by identifying how quickly things in the cardiac cycle are occurring, we can compare your numbers to healthy individuals, to individuals who play similar sports that you do, to those who have similar careers that you do. And by doing so, you get a strong comparison to understand where your heart function is at. Okay, so essentially we can stratify your cardiac cycle timing intervals based on if you're female, male, and also based on your age. So individuals between 20 to 39, 40 to 59, and those 60 and above have changes in these cardiac timing metrics. And based on your data, we can specifically align it to one of these groups of data to get a strong comparison as to what might be going on, the kinds of changes we might see because of age that occur to your heart, and impact of other comorbidities, conditions, medications, and so on as well. One very important metric is this MPI, or Myocardial Performance Index, and also known as the TI index. This is essentially a combination of different systolic and diastolic markers put together, and it gives us an overview of your global heart function. So it gives us a really good insight as to how much stress your heart is under, the potential amount of inflammation your heart might have, and the risk of some future major adverse event that could be occurring. And essentially with this MPI value, the higher your value is, the more impaired your global ventricular function can be. But it's not always the case. Often it's associated with heart rate. So if your heart rate is very high, there's a good chance, because your cardiac cycle is so much smaller, your MPI is going to be higher. So, we can also look at it in response to heart rate, but we can also look at values that are too low. So if they're too low, it also means that your heart function might not be as proper as it possibly could be. So there's a few reasons as to why things like your myocardial performance index might be too high or too low, but it's a very, very important one to monitor, because it gives us really strong insights as to the risk of some future adverse event potentially occurring. Okay, so last thing to note is that these timing intervals in your cardiac cycle can also change depending on if you're an athlete. Athlete hearts are often very different than non-athlete hearts, so we've also been able to publish these findings on a couple hundred university-level athletes, so between the ages of about 18 and 25. And for some individuals, this can provide a better comparison than just the data that's available on the general public as well. And this includes the same kind of data across all the various different cardiac cycle parameters. And really, the main differences we see between male and female athletes are also found in the general public, but the values themselves in athletes are a little bit different. So to summarize, it's important to note that cardiac timing is really, really important because the cardiac cycle itself is tightly regulated by timing. As your heart rate increases, your diastole, so the time where your heart is filling with blood, is going to shorten, and that can affect your filling properties and parameters. Your isovolumic times, so that contraction and relaxation isovolumic time, those are reflective of the efficiency of your heart. And the myocardial performance index, or the MPI, is a global integrated marker of both systolic and diastolic function. And changes in this marker essentially tell us if we're at greater or lower risk for a potential adverse event to occur. And it's a marker that we can monitor pretty easily, pretty consistently, including post-treatment or anything else as well.